Hello and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, we talk about all kinds of global health issues. I'm Joe Schmidt, and with me is Melvin Sanikas. Good morning, Melvin.
Good morning, Professor Schmidt. Hello, everyone. Melvin here, your friendly neighborhood vaccinologist and @vaccinologist on Twitter.
Yeah, and we have been knowing each other for a long period of time from vaccinology, and we will cover here today the corona pandemic. Where are we? We will cover vaccines and therapies against COVID-19. Should vaccination be accomplished in the morning? Nice data that Melvin will introduce to you. And finally, a very important topic, particularly for corona. Immunity is not equal to protection. Melvin, what is the update on the corona pandemic?
Yeah, so this is from the World Health Organization COVID-19 situation report. It basically shows the number of cases from the different WHO regions and the total number of deaths. So note that these are numbers reported to WHO, and they do not really double check the figures. They're just reporting as they receive them. So as of early June 2022, over 530 million confirmed cases and over 6 million deaths have been reported globally. But the number of new weekly cases has continued to decline since the peak in January this year. And the number of new weekly deaths also continues to decline. I mean, we can argue that the number of cases will, of course, go down if the countries are not testing as much as before, right? But the number of deaths is not dependent on the frequency of testing. So the decline in deaths is a good sign, I would say, even though we have all these newer Omicron variants and subvariants circulating.
Melvin, what I like about this map is actually this graph is that they say number of cases and not incidents. And the reason is, as you say, the incidence depends on whom you are testing. If you test every party goer or everybody who wants to attend a big music festival, then you get different results than compared to a country that only tests if you're sick. And incidence would really be sick people or whatever your case definition is. So WHO only reports cases, right?
Yep, that's right.
And as you say, I guess the number of deaths is really going down. That is very good news. What do you think of the new variant in Portugal? Will this cause a summer wave in Europe?
Well, this Omicron subvariant BA.5 actually is around 90% now of the new COVID infections in Portugal. And this has been shown to be more immune BA.2. So this is the same variant that's causing waves in other countries. And also this is the same subvariant that caused the fifth wave in South Africa last month. But remember that the government lifted most of the COVID-19 restrictions in Portugal already. So this includes the mandatory use of masks in indoor public spaces in April. So the rise in cases really is due to the subvariants and the lifting of all the mask mandates in the country.
Interesting insights. So let's see what's going to happen. We hate speculation, but I guess sometimes it is needed is scenario planning, less speculation, right?
Yep.
Yeah. Very good. I have some interesting information from the New York Times, and actually that is my preferred news for COVID because they really have a great page on coronavirus and corona pandemic. And what I particularly like is their vaccine tracker. All vaccines around there are covered there in their faces, and this is the summary table. More than 100 vaccines have been developed or are in development, actually. And as you can see here, 36 are still in phase 1. And I wonder if this will be a commercial success, right? If you're number 101 as a vaccine manufacturer, you will have a hard time competing with those who were first. But interesting enough, 12 vaccines are approved, and in or in full use, and in 19 are in early or in limited use, like an emergency use authorization. Interestingly, also 15 vaccine candidates have been abandoned, and that means there was a problem that people had not considered. And look, if you look at the only at approved and abandoned, there are more abandoned than approved. And if you look at the total numbers, this vaccine development is really risky business. You never know if you're going to make it. And even in phase 3, there is a 30% chance that you will not show efficacy or safety, so that you will not get a license after. Interestingly, also, there are only very few drugs that are approved. And here you have to go from left to right. 2 are FDA approved, 8 are widely used. And if you go to the very right side, 3 are pseudoscience or fraud. So I think it is very interesting to see many vaccines out there, few therapies. My interpretation is molecular biology has it made very simple to come up with a vaccine candidate. Give me the genome and I give you a vaccine candidate. If you make it to the market, it's a different story, but you have a candidate. For treatments, it's different because viruses multiply in a human cell. Viruses multiply in the human cell, and if you attack them, you attack the human cell. Much more difficult to accomplish, apparently. But Melvin, maybe you have another view why we only have few drugs and so many vaccines.
Well, you're right, Professor Schmidt. Of course, the biology of the virus, and because of the fact that they're inside the cells, so it's difficult to really, kill them while they're inside the cells, because you risk harming the cells as well, right? So that's one. But the other thing I can think of is the funding. Early on in the pandemic, most of the funding from the US government, from EU, and from other funding agencies, they were really focused on vaccines. Hence, all these vaccine candidates we're seeing, that we have like over 100 vaccine candidates now. So I guess it's biology and the money.
Yeah. Still, it is interesting. Drugs are, I guess, from a public health point of view, only a second choice. You want to prevent and not treat, right? Look, if all patients would really come to the hospital, even if you have a drug, you would not be well off, right? Just because of the masses of people that you showed on the WHO picture before. Anyway, this is the situation. And coming back to vaccines, you have some new insights on the timing, when to give a vaccine. And
yes,
that you have here on this. Can you summarize for us?
Yep, this is from Science Immunology, published just several days ago, actually. This is a review from a group at the University of Geneva here in Switzerland. And I really find this interesting because we know that the immune system is dependent on the time of the day. We've hypothesized that from the past, but this is a comprehensive overview of the circadian immune system, looking at the recent advances in the rapidly expanding field of circadian immunology. And the paper also shows that if you compare vaccination of the BCG vaccine for tuberculosis, for example, the influenza vaccine and COVID-19 vaccines, those getting their jabs in the morning had better immune response as compared to those who got it in the afternoon or in the evening. And this can potentially have public health implications if more and more studies show benefit not only of immune response, but of protection for those getting vaccines in the morning. And this actually makes me think, because for my older vaccines pre-COVID, I used to get it in the morning because I get the vaccines before I go to the office. But for COVID, I got all my doses in the afternoon or lunchtime. So it makes me think now, maybe I should have got it in the morning, no?
Yeah, Melvin, that is an interesting thought. Actually, given my age, I'm a retired person by now. One of my friends came up with this idea like 20 years ago. And I'm very happy that somebody really took the chance now and really looked into this in a little bit more detail. The one challenge I have here is, what does immunology mean? What is the impact? Does it really mean if you have higher antibodies, are you protected in a better way? Does efficacy go up if you get the vaccine in the morning? And for this, I have one more slide prepared here, and the title is "Immunity is not equal to protection." And that is a very important issue. Even if you have tons of antibodies, it does not necessarily mean you are protected. And even if you have no antibodies after you got the disease or after vaccination, it does not mean you're not protected. So immunity is not equal to protection. There are two things. And the media particularly mix this up all the time. They speak about immunity and they mean protection. And sometimes they speak about protection, but they show you antibodies. So there is a disconnect here, and this is something we need to communicate. If you are protected, and the height of antibodies and the amount of T cell, it depends on your vaccine. And I start here at the bottom of the slide. It depends on the vaccine type, on your booster doses. Tens of different items can change your antibody response. And again, you can have high or low titers, and you may be protected or not protected. It depends on your individual genetic background. It depends on the medicines that you take. It depends on predisposing diseases that you may have. So even if you have great antibodies, but you have cancer and you are treated with immunosuppressant chemotherapy, you may not be protected. Epidemiological factors are important, and certainly also the virus or the bacterium may affect you in a way that even if you are immune, you are not protected. I have great antibodies against diphtheria, but if you take diphtheria toxin and inject it into my vein, nothing will happen initially. But if you increase the amount of toxin, I will die at some point. It's a question of infectious pressure of the infecting dose. So just as a cautionary note, always watch out. Is it immunity or is it protection? And people mix this up all the time.
Yes, all the time, especially in the media, and especially with all these experts who are trying to be interviewed and always saying that because of waning antibodies, we need another boost. And so if this is your argument, we're going to have to boost everyone every 6 months now.
Yeah. And actually, one addition only. Immunity is simple to measure. You take 100 subjects after vaccination or after receiving a placebo, and you look for antibodies. 200 subjects, a couple of tests, some 10,000 euros, and you're done with your study. Protection means tens of thousands of people that you need to test. I think the original first Pfizer-BioNTech trial and the other trials following had like 40,000 subjects in the trial to show protection. With a long period of follow-up, this is really expensive. So you read about immunity all the time because it's simple to evaluate, but protection is very difficult to find. And maybe we cover protection and how to evaluate protection in one of our next sessions.
Yeah,
any other comment on this slide or for today?
No, I think this is really helpful. And I think we should also tell the audience that they can see this and more information if they go to the Vaccine Tutor.
Yes, our website on vaccines and vaccination with Global Health Press. There you will find a vaccinology course. You will also find much more information, and you will find the TBE book. We have just launched the 5th edition, and there will be a press conference on June 14th. If you have any inquiries on that, please contact Daniela Lamarca at globalhealthpress.org, as you can see down here.
Professor, just tell people that TBE is tick-borne encephalitis in case they're not aware of what that is.
Okay, TBE is tick-borne encephalitis, and in German it is Frühsommer meningoencephalitis, FSME. And this is, vaccines do have side effects. I guess it is dangerous to get a vaccine, right? Particularly if somebody doesn't use the right classes here. But anyway, thank you very much for listening. Melvin.
Thank you, everyone. Stay safe and always get your information from trusted sources.
See you here again next week. Bye-bye.
Bye.